Hello, warriors and supporters. Welcome back to another episode of CWF Presents CRPS / RSD is Real. This week we welcome our guest, Dr. Gloria Tumbaga of Wellness Diagnostics and Medispa, located in Temecula, California. We are also honored to have her as a member of our board. Today she's going to discuss with us some of the treatment options in which she offers warriors. She's also going to discuss with us some new treatment options and clinical trials in the works. Without any further ado, welcome to episode 5.
Welcome. I'm Kimberly Cegelka, CRPS Warrior and volunteer with the CRPS Warriors Foundation. Today we're talking to Dr. Tumbaga. So if you could just introduce yourself and tell us what your specialty is.
All right. Thank you for having me, Kimberly. I really appreciate you guys taking the time to get the word out on what we do here. A little bit about myself. I'm an anti-aging and regenerative medicine physician. And so basically what I do is I try to use everyone's body to heal itself. So we slow down the aging process. We use advanced techniques and treatments that will help repair one's body to restore them to hopefully pre-injury levels and just help with any inflammation that they've been going through and just trying to just promote tissue repair and healing.
Okay. So what are some of these techniques that you use?
What techniques we use? We start off with the basics, and they seem like they're difficult to do, but they're not really that difficult. But in our culture and society right now, these things are really hard to do. So for starters, I always recommend, number one, having an overall balanced diet. No processed foods, nothing that is highly inflammatory. Certain foods are really inflammatory and that will trick the body and put it into overdrive and, causing a lot of free radical damage. So as easy as it sounds, that's huge. Food is actually medicine, right? Is what we say. Right. So I would say diet is huge. The next thing is taking care of sleep. A lot of people, we're so highly stimulated in the world because we have technology, we have computers, we have phones, we have iPads, and we just keep our brain on overdrive and we don't get enough sleep, and so in order for the body to repair itself, it needs to get the rest and recover. And so sleep is really important. And then optimizing the body's strength. For example, when we get older, we start to lose muscle mass. This actually is important because if you don't have the strength and ability to perform your activities of daily living, then that will hinder a person. So just having, that basic exercise routine, it doesn't have to be anything extraneous or difficult, but everyone needs some form of exercise. So I try to stress that to all our patients because that's something that you have control over, right? And then once we optimize that, then we work with the patients so that they can address that. And then we will offer other treatment modalities that we all need no matter what, even if you don't have a condition, because there are people who want to maintain themselves, just overall wellness. And so one of the treatments that we offer here is called NanoVeed. And this is an advanced technology where we're using ordered water in the form of a humidified water that's connected to a device, the NanoVeed, and it's transmitted via nasal cannula, and it goes into the nasal mucosa, and then the technology is absorbed there, and the nasal mucosa is where the ordered water gets transmitted and it goes into the bloodstream. And from there, it's able to restore the charges on the proteins. If you think about it, our body is made up of many, many proteins, right? Going down from, we want to start off by amino acids. They're the building blocks, right? Then we make peptides, and then we make these other structured proteins. If we don't have that, then how can our cells function properly, right?
Okay.
So what this technology does is that it will restore any oxidative stress on the body. Like even breathing right now, we're causing free radicals just by breathing. There's a byproduct of that process on a cellular level, right? And so this technology will improve the cellular activity by assisting the protein folding process. And that all has to do like on a microscopic level, but just know that this will help the proteins and the DNA function a lot better.
Let me see if I'm understanding this right. It's using unified air that goes in through your nose and then is absorbed.
It's the medium is going to be humidified air, which has some water in it, right? So if you look at it's hard for me to show you, but there's a device and it has the distilled water in it. And then when connected to the device and it transmits via nasal cannula, which is this, have you seen those nasal cannulas where it's used to deliver oxygen to patients?
Okay.
It's
yep,
like
I can picture that.
That's connected to the device, and then they just basically are inhaling the air in the form of this humidified water, and that in turn gets into the mucosa and the nasal cavity, and then from there it gets into the bloodstream, and then the technology goes to the cells into the bloodstream, and that in turn helps with improving the quality of the proteins.
Wow. So what does this increase of quality of protein in the cell translate into somebody's body? How will they notice the differences?
Everybody is different, but what it does is that there are actual tests to show improvement in recovery of the patients. Like let's say they just did a marathon run or they want to work out. It improves the recovery time and it repairs the damaged chemicals and that are in the body. And also when we exercise or we put our body under a lot of stress, we produce the lactic acid. And so this actually will help with that. And it modulates some of the immune markers in the immune system to diminish the inflammation. And it improves the antioxidant activity. So like I said, the free radicals in the body. So one will know this. It's all individualized. Like for me, what I do is I just started playing pickleball and I do work out. So I am not one to, I can't do the treadmill or like stationary workouts because my brain is like, I get bored. So that's why I do pickleballs. You get it, right? Like,
yeah, I definitely get it.
So what I usually do is I will come into my office in the morning. I'll get my NanoVi treatment for 15 minutes. I'll just put the nasal cannula on, turn the machine off for 15 minutes, and then I go to my gym, which is like 1 block over to the fitness center. I do my workout. I'm able to easily do 1 mile of my lateral ski. It's actually kind of stationary, but I'm able to do that. Usually, if I don't do my NanoVi, I struggle at even doing half a mile, but I can easily get through the 1 mile. That's my warm up. And I can do it in probably like 10 minutes as opposed to like I work out in like 20 minutes. That's just my warm up. And then I go do my circuit training, my strength training. That's how I've noticed that there's a difference. And I can feel myself too. I feel the difference personally. And so that helps me with my recovery time and longevity. There's a lot of athletes currently using this with the UFC fighters, marathon runners. Some like to use it after stressing their body because the body grows when it has a little bit of stress, right? You want to put the body through some of that, but there's a balance with that. So some will do it afterwards so that then they can do the quicker recovery time. Some will do it before, like for me, I like to do it before, but with this device, you can use it as many times. You can get as many treatments as you want. So sometimes I'll do it before and I'll actually do it afterwards. We've been doing this on one of our patients is a basketball player, high school basketball player. So he'll come in and do the treatment and he usually has low endurance for some reason. I don't know why. He's 16 years old, but he's unable to keep up sometimes. And he plays like first string on the basketball team, but he's noticed a difference. So he'll come in the morning before his basketball game, do the basketball game. and then have more endurance, and then he'll even come afterwards.
Have any of your patients with CRPS tried this technology to see if it helps with their healing at all?
We haven't had anybody do it yet, but
Okay.
I did talk to the owners of the company, and anything with inflammation, which, in CRPS population, they're highly inflamed, right? And
Yep.
so this will help heal the body. I personally haven't. That's why I'm trying to put together a little mini study with Deb so that we can see how improvements are.
That's really exciting for there to be a possible new non-invasive therapy that could help our bodies heal themselves.
It doesn't hurt. You just sit there, and then what I usually like to do is I just put it on, I turn the button on, and then I like do work while I'm laying there, or I just literally will lay there for 15 to 30 minutes and get the treatment done. Painless, you can't feel anything. All you feel is just the air going into the nasal cannula, and that's it.
Wow. That's very cool. Is this new technology? How did this come about that you learned about it and decided that you wanted to use it?
Every year I go to a conference for anti-aging and regenerative medicine. And so we were there, and we tested it out there ourselves. So we did a pre-treatment, and then we did an actual test for the markers. And then we did it afterwards again. And then we looked at the data, and the breathing test that was performed showed a improvement overall. So there was objective data for sure showing how it helped improve the person's heart rate variability, and there were some other markers on there, and I was impressed. And I like to try all the treatments on myself first before I invest in it. And this technology has been around for a while now, at least from the company, 10 years.
Wow.
Yeah, so it's been around for a while. It's just that I recently learned of it. And in my practice, I like to bring innovative technology and be the first one to perform it based on the science. And so I did my research on it, and I read the reports and the studies, and I tried it myself personally and on my team, and I do see some improvements.
I think that's wonderful. You have much more of a connection when you've tried it yourself. You can see how it is going to help your patients. You see that it helps you, so then you want to help the people that are your patients. And the fact that you are looking to do a trial where it could see if it could benefit CRPS patients is really fantastic.
Excited.
Yeah, that's awesome. I did read that you have done some other treatments as well with laser therapy. Can you tell me about some of the laser therapy that you do?
The laser therapy, we've been doing that for the past 5 years now, and it's absolutely amazing. We treat a lot of injuries, musculoskeletal injuries. We're using low light laser therapy, and what this does is that it helps the body heal itself using its own growth factors. So the laser light gets directed to the area of discomfort, and then that in turn, it doesn't hurt or anything like that. It just feels like a warm, probably, if that. Some people don't even feel it at all. And then the body's going to be secreting its own growth factors and helping with diminishing the inflammation. And so we've had such amazing results. And, with the condition, some people's bodies actually are affected all over. They can get like one trigger spot, right? And sometimes it's just all over. And so we just try to focus on one area, at least control that, and then work from there. But so far, I want to say the patients that we have done the treatment on for the CRPS have had improvement after even one treatment.
Wow, that's amazing. Is it something that you get a certain amount of treatments depending on the person? Is it once a week? What kind of system would you set up for somebody?
Ideally, if they come in once a week, that would be great. And we would focus on that one area that has a pain or discomfort. And then we kind of just tailor it to what they need. Sometimes, patients want to come in more than that, and that's fine too. But some, it all depends on like how large the area is or how small it is. When we focus on one area, we notice a significant difference. And this is from the patient reporting it to us immediately after the treatment.
Wow. Mention to you how long that relief lasts for?
They're going to get relief for some, they've reported like for about a few weeks until their next treatment. Yeah, I mean, it's pretty impressive. We do this treatment on musculoskeletal motor vehicle accident patients. And so for those patients, they've reported to us that they've seen a difference with the mobility and then decreased discomfort. We had one patient who had a injury from she had a frozen shoulder. So basically she could only lift it up so much. She had had multiple surgeries already and she had a frozen shoulder from all the, the scar tissue that was in there. And then she had to undergo general anesthesia to break it up.
Oh,
So she had done that. But even when she had done that, she only could move up 10 degrees, if that, maybe even 5 degrees. I did one treatment on her. Immediate after, she was able to lift her arm by 20 degrees difference in one session.
wow. So that is what, reducing inflammation by using the
growth factors. The body
growth
has
factors.
its own growth factors. Yeah. It has its own growth factors to diminish the inflammation and produce healing properties. So
Wow.
that's exactly what regenerative medicine is. We're using a stimulus to help the patient's body heal on its own.
That's very, very cool. Is this low light therapy? I know I've heard of red light therapy. Is it similar in any way?
No, this is going to
No.
be a lot more robust. Yeah. There's another form of therapy that we offer, but this is definitely not red light therapy.
Okay.
That's different. We have PMF. I think that you guys might be offering that to your warriors. I think that's a great technology as well. So we use them all in conjunction. Synergistically, they work fabulously together. The PMF is great because it causes vasodilation. The nitric oxide stimulation causes the vasodilation, and that in turn brings more blood flow to the injured area. And when you have blood flow to the area, you have more nutrients to the area, right?
Right.
So then that's very helpful. And so while they're getting that treatment done, we actually have them on the NanoVeed at the same time as well. So you can optimize the increased blood flow to the area and then diminish the oxidative stress on the body, improving the function of the proteins in the body. It's a great combo. And more often than not, a lot of the patients with this condition need to have multimodal treatments in order to alleviate their symptoms. And some do great with just only one, but when you optimize each of those different technologies, just going on different areas, they get improvement.
And the PMF that's a mat that you're talking about, right? That you lay on top of? I've heard wonderful things about those. And can you just explain what the PMF stands for, just for if there's people that don't know what a PMF mat is?
It's a pulse electromagnetic field. And what it does is it creates there's different frequencies, and then it just kind of works at that microscopic level again with science and physics. And then that in turn tells the cells or tells the tissue, let's produce nitric oxide. And then the nitric oxide is what causes the vasodilation. And then when you have vasodilation, there's more blood flow to the area. It also works on the mitochondria, which is the powerhouse of the cells. It's what generates the ATP, which is the energy. So if we don't have that in our cells, then we don't have our mitochondria functioning properly, then it's difficult for us to repair itself or even have the energy. We all need energy just to walk or breathe or do anything for the most part, So that is huge when you can optimize that as well.
Would you tell us a little bit about how you were introduced to CRPS?
Oh, okay. That's a really good question. Deb and I belong to a local chamber, and I was giving a presentation one day on it was several years ago actually, on skincare and how to self-care. It was all about self-care and how to take care of yourself. And then I think I was just giving a talk on that, on having mindfulness and, just talking about how can we be our best self. And again, we talk about the little things that we can do, which are very difficult these days to do, but it's so simple and it's cheap, but it's hard for us to do. And so she was on that talk that seminar I had, and then she reached out to me and I said, oh my gosh, I have no idea what this condition is. I never learned about it in medical school. I think it was probably under a different name back then. And so I kind of researched it myself and I said, oh my God, Deb, you should help me out here. I really want to learn more about this. And so I, you know, through the patients coming here, and me reading about it on my own and asking her and actually just seeing the patient suffering, like it just made me, think about what can I do to help them. And so we just developed a friendship over the years. And she asked me if I wanted to be on the board. And so that's why I am very passionate about helping everyone with this condition, because it's such a debilitating condition. And I just can't imagine you also going through this. And, it's not easy.
It's not. But it's wonderful to know that there's people who are willing to try different technologies to try and help people, and that there's people who, like, you met Deb and that's how you learned about CRPS, but you don't have it yourself, but you are empathizing with people who do have it, and you want to help people, and that's really wonderful to know there's people out there like you.
Thank you. I really, that's the reason why I went into medicine, because I want to be able to help people and alleviate their suffering. And I think that it's our responsibility as physicians that we need to do that. We can't be closed-minded and say that, oh, there's no cure for it, and then just stop there and let people suffer. I think that's not the right thing. And I just want to spread the word about it and let all my other colleagues know as well what it is, because it all starts from there, and educating everyone on the nature of the condition. And, there's a lot of stigma and biases, and people don't really know, and especially physicians too, So I felt like I really wanted to learn more about it, because when I saw Deb suffering, I said, oh my gosh, this is just not, how can we let people suffer like this, So, I mean, any treatment that I think that might help, I'll research it and then let Deb know about it, and then we can spread the word, you know what I mean? And find out who in the net has this device or treatment available, so that we can help them alleviate their suffering, at least some.
That's wonderful. So with this nanotechnology, what is the actual, I'm just wanting to go back to that for a second. Because you mentioned that the technology is where it's absorbed. I know this is going back a while, but what is the technology? Is it that it changes properties in the air that you then absorb? I'm just trying to understand it. I was just curious what it does to the water.
Yeah, the humidity in the thing passes through this absorbable electromagnetic energy, and that includes like the wavelength that excites the reactive oxygen species that it emits. And so the water absorbs these specific energies, right? And then that gets in contact with the mucosa in the nasal passage.
So it's using an electromagnetic field, maybe a different one than the PEMF is, or in a different way, but it's like taking that and then putting it inside your body. It's almost like the water is the device that takes it from one place to inside your body. Okay.
Yes. You absolutely got it, Kim. Yeah, that's correct. Yeah.
Okay. So are there any other things that, I know you said you were working on creating a study to be able to see if this would help with CRPS patients? Is that what you're mainly focusing on right now? Do you have any other research or studies that going on?
Yes, we actually did one. Was it last year? We had some, I didn't talk about this yet, but we are doing exosomes. These are actually microscopic extracellular vesicles that help with stimulating growth factors and cytokines in the body to diminish inflammation. These are a advanced technology, and we did a study. It was actually just a case study report on one patient. She with chronic regional pain. She couldn't lift up her arm, like barely. So we have the footage actually together as well. So she could barely lift up her arm. And then like after the treatment, we did the injections. She could go like this. And she said, I haven't been able to do this in years.
And that was immediately after the injections, she was able to do that? Wow.
Yes. It was amazing. I mean, we have we're trying to put together like a little video on that to show the before and after. And like immediately afterwards on her. So I'm super excited about that, getting that out as well. But they are manufactured in the lab and we inject them. And I myself personally received them too because I have tendonitis in my right shoulder and I have back problems. I've done about probably around, I would say 4 rounds of treatment for myself for my injuries. And I barely have any pain on my shoulder, my right side tendonitis, and which I've had for over 20 years. And then my back is just like, it's pretty stable now, only because I play pickleball and I aggravate it. But other than that, like I'm pretty good. My actual biological age is 24. And actually I'm in my mid 40s. I apply all the technologies and all the treatments that I offer my patients. I do it on myself as well.
How do you factor what your biological age is?
There's devices that you can use to read and see like if you have any sugar glycation or oxidative stress. And then there's other measurements that they use, like you can scan your body to see. And then also by like labs. But the one that I did last year in December, my biological age was 24. So I think I'm doing something right.
Yes, it sure sounds like it. I think people also trust, like if someone says all of these things I do on myself, they immediately trust or feel more comfortable with that technology or with that therapy.
I mean, we've been doing, there's so many different conditions that you can apply the exosomes on. I have a patient who's been seeing me for the past 3 years now. He has liver cirrhosis and abnormal liver enzymes. So it was very impressive. We did one treatment on him first because his doctor was saying you have to do this, that. And of course, some of it is attributed to drinking, right? So he has to stop. We put him on a plan. We told him you need to stop your drinking or slow it down. And then he got the treatment. He went back home and he repeated all his labs and they were all normal. All his liver tests were all normal. So he comes every year to get his treatment done.
That's fantastic. So these are all injections, you said, right? That's how it gets delivered into your body. Is it by an injection? Will it,
yes,
it work in one specific place? Like if you inject it in your shoulder, it's going to work in your shoulder, or is it that it gets introduced into your body and it helps all of your cells?
If we do the systemic one, then it's just going to go wherever the body needs it. If we're doing, like for me, I did it, I've done both, but I do it in my, for locally, like if the discomfort is here, then that's where, like in the shoulder, that's where if it's in the back, then we locally target the area.
Is there anything else that you guys are working on or any information that you wanted to share?
What I would like to share is just I'm in Temecula. If there's anyone in the area that has the condition, maybe they can contact my office and then we can enroll them in the treatment to see how they would do for the NanoVi. Then we can get a study going for that. And that would be good data for us to publish, then we can get the word out. I mean, my hope one day is that like these treatments, patients shouldn't have to be paying for themselves to get it done. I mean, it should be considered as part of your medical care. If they have insurance, it should be part of that, right?
Absolutely. One of the things that's so wonderful about the foundation, about being able to help patients with payments, because so many things that could help people aren't covered by insurance. There's only a very limited amount of stuff that has been covered by my insurance, especially that's non-invasive. So when you're talking about something where this is a non-invasive treatment that could potentially help people, it would be wonderful if it was able to be covered by insurance.
Yeah, I think that would be great. I mean, I think if we do the studies, can show that there's proof that this is helping them, and why not? It should be covered, right? So just getting the word out. And then for me, I like to, a lot of my physician colleagues, they're unfamiliar as well. So I just tell them that, hey, I'm on the board and for the CRPS Warrior Foundation. And I just tell them a little bit of what I do so that maybe they can jump on as well and then spread the word, because a lot of it is education. And I knew nothing before. But now I know a lot more than my colleagues, and we just gotta educate people, educate the public on what it is. so that we can help everyone.
Do you have any tips on how people can help educate other people? Like, is there anything people might like the idea of advocating or educating other people, but they don't know where to start?
So I think it all starts on, you guys have a wonderful forum. You guys have the Facebook page. So that's great. For me, I'm just doing it within my own network. You guys are doing a fantastic job at promoting and educating the public. And so I belong to a lot of the support groups online because it was more for me learning about what is the patient's perspective and what treatments have they done and what's worked for them. It's a process, I think, and putting yourself in front of the people who have the condition, and then for me being on the other side of the treatment side. So I'm trying to educate some of my colleagues, hey, the physiatrists and then other pain doctors, it's not just giving them the narcotics and things like that. Let's just try other treatments that we don't have to disrupt their body to have them have a possible addiction later, right?
Right. Absolutely.
So just talking about it, you know what I mean? So that it's not like a stigma, or like I started off with not even knowing what it is. But now I can say I'm not an expert, but I do know the patient side of it from the docuseries that you guys put out. And also being a part of that, it just opened up my world on like what you guys go through. We just got to get the word out, and you guys are doing it. And I just say, talk about it. We can have more conferences, seminars on it, and that would be the first step. This is not related to CRPS, but I'm really excited about it because we are going to be participating in a study for a novel treatment, monoclonal antibodies for Alzheimer's disease. Super excited about that. We're getting all the processes in place. We're doing seminars and educating our community about this condition as well, which is, it is a debilitating condition, and it affects a lot of people, a lot of men and women, and sometimes it runs in families. And so I'm really excited because this treatment is unlike the others. This is actually going to help diminish some of the causes, the plaques that build up in the brain, to help improve the cognitive impairment for those with moderate to severe Alzheimer's disease, to improve the quality of life for the caregivers and for the patient. It's still a work in progress, but from what I've been reading and the proof of concept with the study had showed great improvement. And so that's why now we can move forward with proceeding with the research. And so far it's been deemed safe.
Yeah, that's huge. I wish you the best of luck with that.
Thank you so much. I really appreciate it. And I wanted to say thank you so much, Kimberly, for being a huge support for the Warriors and the Foundation, and that the work that you do and all the volunteers there are making a huge impact. And without you, I think that the word wouldn't be out. And so you're doing all the hard work so that we can hopefully find a cure one day. So thank you so much for your dedication to the foundation, and we really appreciate you.
Thank you. And thank you for joining us today and sharing your knowledge and your passion, and for being a part of the board and everything. It was wonderful to talk to you.
Absolutely. It's always my pleasure.
Thank you, ladies, for a lovely show with so much information. It is always encouraging as a warrior to learn that there are new developments still being made. So there is still hope, and the dedication that you have to warriors and researching new treatments and making them readily available for warriors is truly amazing, Dr. Tumbaga, and we can't thank you enough. If anybody is interested in being a part of the clinical trial, you can reach out to Dr. Tumbaga's office
at 951-387-5935.
And that information is also readily available in the description of this episode. If you'd like to support the podcast series and the foundation, you can text CWF Podcast, all caps, no spaces, to 53555. Don't forget to check in on our social media for updates on how our warriors are doing in the Route 66 Conqueror Challenge. And speaking of that challenge, a sponsor of 2 warriors in our challenge is going to be our next guest. Kyle Hartfield of Inland Empire TMS. He offers transcranial magnetic stimulation. Don't forget to tune back in on May 1st. We can learn more about that treatment and meet Kyle. Warriors, stay strong. Know we are here for you anytime, in any way that we can. You can always reach us through our website, crpswarriorsfoundation.org, or by messaging us on any of our social media platforms. Never forget, you're not alone, and you don't have to do any of this alone anymore. And the warrior is meant to fight alone. As they say, it takes a village, and we are the village. Until next time.